over to you, Irene.
Thank you very much, Emily. Just need to make help here. Is that working? Yeah, brilliant. How do I get into my presentation?
Move this forward. Yeah.
Brilliant, thank you. It's really good to have this opportunity to talk about Discover, which is a service innovation that I've been focusing on for the past few years. And it's a chance really to reflect with the range of you in this room about what we do and possibly even next steps. We think a lot about that in our team, and my team is here with me, which is brilliant. So I'll just get going and try not to try to rush it through too much. So this is a service innovation that was originally funded by Guy's and St Thomas's charity and also by Maudsley charity at various points. I'm going to just give you an overview, first of all, of the development of what started as a good idea. And that good idea was fostered by Paul Calaminas, who was a CAMHS director, and by Joe Fletcher, who has been a fantastic support throughout all those years on this. So first of all, I went to Guy's and St Thomas's and talked about my good idea to develop a community intervention for older teenagers. And they very kindly allowed us to do that work, and we developed it primarily in the community in line with an adult mental health intervention run by June Brown, where we considered ways to allow young people to simply appear and get help in local, non-clinic, non-school, non-anything, maybe youth club type of environments. That led to us moving into schools, and in 2012 we began to pilot our programme in a few schools in Southwark. That led to an RCT feasibility study funded by NIHR with June Brown as our PI, and that publication should be out very soon. And that led to us developing and improving our way of working and continuing to work in schools. And very interestingly, we then developed, with the help of colleagues of mine who are in this room today, a way of working with Discover back into the clinic, even though it was an outreach programme. And we piloted both in Lewisham and in Lambeth CAMHS an approach a colleague of mine is continuing with. Christina Lucas from IOP, as a trainee psychologist, has done a pilot RCT. We're now doing a version of Discover for care leavers in that age group of 16 to 19, and that programme is being tested and piloted with Lambeth and Croydon, led by my colleague Lily Lee and my team here. That's been funded by Maudsley charity, and we're just beginning to get to the end of the process of producing the programme. And we are now a self-funding Discover team, and that has its own challenges, and that's been the case for the last year, ably supported by Donna Underwood, who keeps an eye on our budget. And we've been thinking a great deal in the last year with my colleagues currently about how to sustain the change that we're getting in the young people we're seeing. We're developing a teacher training approach, which is more co-created with students. We're thinking about working with child well-being practitioners, and that's been really helped and supported by Wendy Garrity and others in Lewisham. And we're hopefully going to be funded to create a Discover app, which will sustain students' progress. So we're in a very exciting stage of branching out, but I'm going to use a little bit of time to tell you about why we developed the programme in the first place. I think we've already, Talia's already gone through some of the prevalence data, and importantly, to think about the fact that anxiety and depression are most common problems, and also the impact on young people's lives, both in school and socially and within families, is significant, particularly in sixth form, when there are very many crucial decisions to make and things to attain, not just exams, but getting on to the next stage in job and work. So the other thing that is worth saying is that stress, anxiety, there are many, many surveys from parents, students, teachers, head teachers, about how an increased expression of anxiety. And this is a diagram from some of the work we do in our Discover workshop, where you can see the word stress is being deconstructed by a group of troubled young people. Oops, sorry. What's happened here? Oops. Let me just go back. Yeah, here we go. And you can see lots of different words that would express, I guess, transdiagnostically different emotions and the very many different factors that young people perceive as influencing that experience of stress. Obviously, we know there are so many barriers to young people getting the help they may need. It may be partly to do with the barriers in our services that are overpressurized, the way they're structured. It's also something to do with internal factors, perhaps perceived stigma, lack of knowing where to get services, and perhaps a very busy lifestyle. Sixth formers are extremely busy. Lots of ideas about the value of bringing mental health support into schools. There's something about well-being and resilience. There's a massive area. We know about the Green Paper talking about transforming CAMHS so that we work closer with schools. There are views about help being more democratic if you're in a school so that more people get the chance to receive help. There's a very strong call for any intervention in school to be evidence-based and efficient, which is really important for schools. There are all sorts of possibilities of whole school impact and, of course, creating better pathways to CAMHS. So what is Discover? Well, we did win an Innovation in Practice Award, and I think that's probably what we are now. It's CBT-based. Our aim is to go to work very hard to reach young people who are harder to reach for a number of reasons, who are experiencing anxiety, low moods, high stress. We've developed and co-created the whole programme with young people. We're really keen on getting something that's acceptable to reduce stigma and encourage uptake. It's very much focused on real-life teenage problems, problems that young people who have worked with us have defined as the main priorities. It's a self-referral open access system. Our young people are not SLAM patients, which is radical in itself. We work very closely with teachers. We're very concerned about risk management. We have built-in evaluation. Now, the way it works now that we're in schools is that I go along to a school. Once they've agreed the work, I then pitch a very cheesy open chat at an assembly with video, talking about being from the NHS. We've got skills that could be used. We've got techniques you could learn, and do come along if you're interested. We then run an information meeting where interested young people turn up. We have a high number who self-refer. We have another group whose teachers will have encouraged to come along. We then see them individually for an assessment and a discussion to build their motivation for change. Very quickly, this whole process takes 2 or 3 weeks. They step into full-day workshop format, which gives about 8 to 10 CBT techniques to tackle transdiagnostic issues across anxiety and low mood. We then review them by phone, though this has become a harder thing recently, which I can discuss later. We do about a 3-month follow-up with additional follow-ups as needed, and we do a lot of signposting and kind of triaging into services, and we then go back to schools and reflect with them about the results and about anything they would like to alter in the way we work. So, just to say, we cover pretty standard CBT kind of topics, and we also use very obvious methods of workshop where we have both group and individual, and we have discussion, we present material, we do goal setting. But one of our things that we work very hard on is to have peer influencers thinking about the developmental stage of young people. We have 4 characters, 3 of whom have a variety of anxiety and low mood issues, and the 4th one in your bottom left-hand corner is the friend who likes to help people. And we haven't got time to show you these, but we can, if anyone's interested, do come and ask to see them. And they go through stages of demonstrating problems and practicing the techniques that we are about to show the workshop. And surprisingly, at the end of the workshop, the 4 characters have made some progress, and the 4th one, the helper, is thinking about a career in mental health. So it's all very sweet and very engaging, and again, all of that work has been with young people. We use standard outcome measures, and that's been used in our RCT, where we got some really significant results. 5 schools randomised in, 5 as waitlist control, And we got significant reductions in anxiety and in mood, and also in improved well-being. It's nice. Very quickly, I'm going to whip through who we see, because that's important to us, that we get more girls and boys, more year 12, sorry, which is the choice of school. We have a fantastic range of ethnicities. It's around 65 to 75% of young people who come from non-white British UK backgrounds. We have a big proportion of young people with significant mental health needs, most of whom have not received help before. So we know we're reaching young people who need our help and who haven't accessed it before. Some bits of pretty data from 7 recent schools, just to show mood reduction. Again, there's variation even across one academy chain in baseline and follow-up. Anxiety and resilience, as we call it. Just quickly to show you some feedback from young people in more from a qualitative side. Obviously, we've chosen nice comments, but we think that we're getting feedback both about learning ways to manage stress, understanding stress, as we call it, because we don't use more mental health words, ways of feeling with other people who have the same problem, ideas about what they can do for themselves. And we've got some qualitative data supporting those at a deeper level. Again, contact us if you'd like to hear more. And we've also, we're happy with that, very satisfied. Most people in therapies will report high satisfaction, but we're very impressed by what they're talking about. Some quick views of teachers who we work very closely with. They notice changes in motivation, in the ability to get on with work, to stop procrastinating, to engage more with their fellow students. Those measures are still pretty soft. We'd like some help with getting our measure a little bit more robust. But really big impacts, particularly with disengaged, troubled youth, and at the other end, the overworkers who are exhausted and setting themselves unrealistic targets. But it's not just about work-related stresses. Just going to finish with a couple of reflections, because I haven't got time to say much more here. We use a manualised approach. It's obviously difficult to personalise care, though we try to do that in our pre-assessment and post-assessment. It's a challenge for us to think of ways to sustain participants' progress. We have seen 400 in the last 6 months. It's hard to hold them all in our heads, but we need to find better ways to keep them on their goals and engaging more. We need to think about how even more to get more young men in. Working in this way is exciting, amazing, challenging. It's very different from being in a clinic, and I know my colleagues have lots to say on that. There are social contagion effects. That means that some young people say, oh, you're stressed, you've got a problem, you come in. We have friends bringing other friends to the workshop. We have teachers recommending us to other schools. The bad side of it is someone might say, I'm not going in there, he's weird and I'm not like that, or I don't have problems that you understand. So we have to be careful about the impact in the broader system. And finally, just to say where we think we're at the moment, so we're in the midst of data analysis of our latest figures. Over 900 people have been seen in Discover so far, and that's really in the last 3 or 4 years, big numbers. We're benchmarking against the RCT. We're getting more young people with bigger problems, and we're getting a broader range of ethnicity and fewer who have had support. We're working in Lewisham and Lambeth CAMHS, and that is really interesting to think about, seeing people who are a bit, as Talia was talking, are we a low-intensity intervention that could sit with specialist CAMHS? The care leaver work is going to be amazing. We've got to think about how to test and pilot further and also find funding streams for that. We're hoping our funding bid will work, and our Discover app will be very interactive and creative. And our teacher package, I think the thing we're trying to do is not about the material, because that's easy to think of. We're working with young people to say, what would you actually attend to and accept from teachers if we gave teachers ideas like this? And they say things like, don't write a poster, we don't look at posters, thinking about dynamic and creative ways to put messages across. So I think I'll just finish at that point. There you are. So,